A handful of reasons why someone gets decay as they get older in life. There's typically three that always pop up. So the first one is what's called xerostomia, and that's just a really, really fancy word for dry mouth. And as patients get older, they tend to get dry mouth, and there's typically two reasons that they get dry mouth. The number one reason is medications that they're on, typically cardiovascular medications, but a simple Google search on which medications cause dry mouth, you'll find that it's hundreds and hundreds of them. And then the second reason is the salivary glands. There's three major ones, and then a number of minor ones. They tend not to function as well as we get later in life. But the number one reason for low salivary flow or dry mouth or xerostomia is medications. And what happens is the saliva is a natural washing lubricant. It washes plaque and bacteria off of teeth. And when you have even just a little less saliva than normal, that plaque and bacteria doesn't get washed off like it had been your whole life. It sits on the teeth, and in that drier environment, it's much more likely to cause decay. So that's the first reason. The second reason is exposing the teeth to a constant acidic environment, and the number one reason for that is sugar. And everyone feels that they don't consume a lot of sugar, especially in this day and age of everyone being as healthy as they can be. But there's a lot of hidden culprits out there that allow the teeth to break down via sugar. So fruit juices that are considered healthy have lots of sugar in them. Obviously, carbohydrates, refined carbohydrates, the breads, the pastas, all of that stuff is carbohydrate that ultimately gets broken down into sugar. And if that's allowed to sit on your teeth constantly, you're ultimately going to get cavity on your teeth. So it maybe wasn't as big of a deal when you had normal salivary flow, but if you continue to expose your teeth to carbohydrate that gets broken down into sugar, and then ultimately not have the salivary flow to wash that bacteria, plaque, and sugar off of your teeth, you're going to get cavity. And then the final reason, if we're going to just pick three, why older patients are starting to get more and more cavity around the roots of the teeth and underneath crowns and fillings, is lack of fluoride. Many of our patients are from the southern tier, and there's pockets of villages and towns and hamlets and nooks and crannies where there is no fluoride in the water. Many of our patients have well water, but just like everything in life, in moderation, fluoride is an unbelievable supplement to your oral health. What we're finding is with dry mouth, with the teeth being constantly exposed to refined carbohydrates and other sugars, and with lack of fluoride because you're on a well, you're getting tons of new cavity on your teeth, even though you haven't really changed any of your lifestyle habits. You're still eating the way you always have. You're still coming to the dentist. Your home care is still the same high level that it was, but the lack of fluoride, the lack of saliva, and then the same diet is leading to all these new cavities. So, what can you do? First and foremost, have a conversation with me or with one of the other doctors when you come in to have your teeth cleaned about different strategies that you can adopt to combat those three elements. The number one thing that you can do is maintain your wellness appointments with your hygienist. And at those wellness appointments, we would strongly encourage you to have fluoride treatments. That fluoride will combat the dry mouth. It'll combat the bacteria and plaque and sugar that are sitting on your teeth, and it will fight the formation of new decay. The other thing you can do is talk to your doctor about the medications that you're on and see if there's a substitute medication that maybe has less dry mouth side effects. Doing those two things will help significantly. And they don't take a huge lifestyle habit change to do. If you really want to take it up a notch, then I would encourage you to incorporate fluoride into your daily at-home regimen, either through a rinse or a concentrated fluoride paste. And then you may want to think about altering your diet to lower the amount of refined carbohydrate and simple sugars that you're exposing your teeth to. But if you have those three strikes against you, low salivary flow, lack of fluoride, and a moderate to high carbohydrate sugar diet, something has to change, or else you're going to continue to have to need dental treatment on a regular basis. And unfortunately, I've seen situations, it's very, very common, where someone will come in for a cleaning appointment and an exam, and they look great. And then literally 6 months later, because they went on a medication that caused dry mouth, we're seeing 4, 5, 6 cavities develop within 6 months. There's just some strategies to try to be as proactive as you can to not have to go through dealing with dental decay or as much dental decay as you get a little bit later in life. So reach out if you have any questions. If you're not quite sure about something, we're here to help. Call us at the office. You can email me, reach out to me on Facebook or anything like that.